Good afternoon, and welcome back to another edition of Forever Young. I'm your host, David C. Linton, and this is the show that celebrates life for those of us who are over 50, because we know that you're as young as you feel, and life ain't nothing but a number. You know, with age comes wisdom, and of course, I'm always surrounded by wisdom and beauty, and I couldn't do the show without my two fantastic co-hosts. And first, we missed her last week, but she's back. We gave her a little hiatus, but she's back. And of course, I'm talking about the beautiful Miss Jean Hendricks. Hello, Jean, and welcome back.
Thank you, David. I am delighted to be back. I missed the show and I miss being with you all. Thank you so much. Back to you, David.
All right. And of course, the one who keeps us all together and is one of the producers of the show, and that is none other than Dr. Sharon Mitchell. Dr. Mitchell, welcome back.
Thank you, David. Always a pleasure to be with you all, and so glad to have Miss Hendricks back. We missed you, and we again have some exciting information to share with our audience today. Back to you, David.
All right. Now, on this program, we've been talking since the new season started. We've been talking about COVID, pandemic, vaccinations. And last week we had the opportunity to have Dr. Kemio Harris on to talk to us, Kemio Harris Williams on to talk to us about the vaccinations. And she's going to join us again. But of course, the one thing we did miss from last week's show was those pearls of wisdom that comes from Jean that kind of starts the show off. And so, Jean, now that you're back, I know you've got something for us.
Yes, I do, David. And this one is entitled Pandemic Poetry, Calming Words in the Midst of Chaos. And this is a teacher talking to her students in class. And it says, how can we determine the hour of dawn? When the night ends and the day begins, asked the teacher. When from a distance you can distinguish between a dog and a sheep, suggested one of the students. No, was the answer. It is when one can distinguish between a fig tree and a grapevine, said a second student. No. Teacher, please tell us the answer. It is then, said the wise teacher, when you can look in the face of a human being and you have enough light to recognize him or her, your brother or sister. Up until then, it is night and darkness is still with us. Back to you, David.
What we're trying to do is dispel the fear. And so that is so appropriate. So I'm going to get right to welcoming back to our show Dr. Kemio Harris Williams. Dr. Williams is both a medical doctor, an academician, and she's also the president of K.H. Williams Enterprise, Inc., an executive health entity focused on health advocacy, clinical practice, and medical consulting. She's been affiliated with the Delta Research and Educational Foundation Research Matters for All of Us initiative, funded by the National Institute of Health and Research Program. And ever since 2018, she co-chairs the Louisiana Regional All of Us Advisory Board and a medical expert consultant for other organizations funded by the NIH All of Us Research Program. And so we have someone who has medical background, steeped in research, so we can continue our conversations about COVID-19, vaccinations, and everything that goes along with it. So without further ado, I'd like to welcome back to the program, Dr. Williams. Welcome back.
Thank you, Mr. Linton. Thank you so much for having me back. It's a pleasure to be with you all today.
You shared such great wisdom with us last week, and as we talked about last week, your area is in pediatrics, dealing with the children. And so as we were talking last week and just before we had to wrap up part one, we really started talking about vaccinations, children. We debunked some myths about the vaccine. We broke down what COVID-19 actually is. So I guess to start us off in that same path, I guess the simple question is, why should a child get vaccinated against COVID-19? It may sound silly, but there are a lot of people who say there may not be a need.
Right, right. So getting a COVID-19 vaccination can help protect your child from getting COVID-19. So that's a big reason why. Early information shows that the vaccines may help keep people from spreading COVID-19 to others. They can also help keep your child from getting seriously sick, even if they do get COVID-19. So widespread vaccination is a critical tool to help stop the pandemic. Currently, children 12 years or older are able to get the Pfizer COVID-19 vaccine. The vaccines have been proven to be safe and effective. COVID-19 vaccines have been used under the most intensive safety monitoring in the United States history. Your child will need to get, as far as how many doses, your child will need to get a second shot 3 weeks after the first shot, and your child can't get COVID-19 from any COVID-19 vaccine, including the Pfizer vaccine. Um, and just another interesting tidbit, your child may get a COVID vaccine and other vaccines at the same visit. So say if your child is due other childhood vaccines, they can get the same one.
That's good.
Or if not, they will have to wait 14 days between vaccines. So that's another, a little more information about getting the vaccine.
Mhm.
Yeah, that's so important
Mhm.
because I know that people have been hesitant and saying, well, if my child has to get measles vaccine or some other kind of vaccine, how's that going to affect it? So the fact that you just really cleared that up at the onset is really important, that it does not affect any other vaccinations that a child may be ordinarily get. So Jean, we're back. So I know that you missed being here. So we're going to let you fire off the first question.
Okay, Dr. Williams, do children experience the same side effects from the vaccine as adults? Or are there any?
So go ahead. I'm sorry.
No, I just said, are there any side effects from the vaccine for children?
Sure. Thank you, Ms. Hendricks, for that question. Yes, children can experience some of the same side effects from the vaccine as adults. What I like to tell parents is to prepare your child for the vaccination visit. So talk to your child before you go in to let them know what to expect. Make sure you tell the doctor or the nurse about any allergies your child may have. Comfort your child during the appointment. There's been some episodes of fainting because of anxiety as it relates to getting the vaccine. So make sure to protect from fainting and injuries related to fainting. Your child should be sitting or lying down during the vaccination and for about 15 minutes after the vaccination is given. After your child's COVID-19 vaccination, you will be asked to stay for 15 to 30 minutes so your child can be observed in case there are any severe reactions or need any immediate treatment. So some of the side effects, normal side effects, and we say normal because these side effects are showing that your body is building a protection against the virus. So some local side effects include from where you receive the shot in your arm, you can have pain, redness or swelling. Some more systemic side effects in the rest of your body include tiredness, headache, muscle pain, chills, and fever. Those are some common side effects. Some people have nausea as well. So these side effects may affect your child's ability to do daily activities, but they should go away in a few days. Some people have no side effects. So, in full transparency, the CDC has released increased reports of myocarditis and pericarditis in some adolescents and young adults after COVID-19. The known and potential benefits of COVID-19 vaccination outweigh the known and potential risk of these possible side effects of myocarditis and pericarditis, which myocarditis is just an inflammation in the muscle tissue of the heart, and pericarditis is inflammation in the cavity around the heart. So those are some, some severe side effects that have been seen in only a few cases. So, but as I said, the benefits of COVID-19 vaccination far outweigh the risk.
What's up, House of Hope? It's the Flavor King. Today what we got in store, we're gonna be cooking up some roasted chicken, some Brussels sprouts, and a fresh fruit salad with a honey lime drizzle. Y'all ready? Let's cook.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
I'm Miss Kim, and today we are going to talk all about life cycles.
I'm so glad
Thank
that you break those big terms down into layman
Yes.
terms.
Out. Yes.
Because I was going to have to go to my medical book real quick to do a follow up. But that's really good to know because, again, like you said, some people have
Yes.
no side effects. I had my vaccines, I had no side effects at all. And there are other people who had that, some of those symptoms that you have, but to know that they just as in adults, as in children, they'll just be, temporary and things will go back to normal. So Dr. Mitchell, I know you've got a couple of questions
Yes.
for our guests.
I do. Dr. Williams, it's so great to hear you explain as a pediatrician, particularly how to prepare your child, what to expect. And so since you're a pediatrician, there are other myths that people have put out regarding children receiving the vaccination, such as it can cause SIDS, multiple sclerosis, or other problems. Can you address those issues as relates to whether the vaccine actually causes any of those conditions for children?
Sure. Yeah, sure. Thank you so much, Dr. Mitchell, for that question. So there hasn't been any evidence from studies
Okay.
done to substantiate the fact that vaccines causes SIDS. A lot of times SIDS sometimes happens before vaccines or most vaccines are given as it relates to childhood vaccines, nor multiple sclerosis or other disorders. There hasn't been a link to vaccines as it relates to that.
Excellent.
Okay. And a follow up to that, what about autism? There have been, do vaccines not only just on, do they cause autism? Not only just the COVID, but vaccines in general, do they cause autism?
This has been widely studied. This was really hot topic several years ago, and it's been widely studied. And there hasn't been any link between vaccines and autism. I personally have treated patients and have patients who are diagnosed with autism, and in my personal practice, haven't seen any link between vaccines and autism, and nor has the research shown that there's any link between the two.
That's good. I'm just loving the fact that we are debunking all of these myths that we have
Yes.
because, people have these, I guess they call them urban myths or whatever you might want to call them about the medical field. I always say sometimes we take advice from people who failed biology, but here we are. I'm so glad that we have a professional who can really give us some insight. Jean, I know that you wanted to ask her a question, so we missed you,
Yes,
so
I
we're going
do.
to let you get to it. Yes.
Okay, Dr. Mitchell, Dr. Williams,
Mhm.
as a medical provider, how has COVID changed how you deliver services in this time of in this season? And if so, how has it affected your practice?
So, thank you for that question. I find myself in a very unique position as a medical provider during COVID because I stopped direct patient care about a year prior to COVID, and hitting the shores, before COVID hit the shores, and I started focusing more on health disparities and health advocacy, working with one of the nation's leading research institutions. So, in light of COVID affecting, the African American community and people of color so disproportionately, this has affected my practice and my engagement in the community substantially, and also it enhanced the need for research in these areas, and it enhanced the need for advocacy in the area of disproportionately affected people who are affected disproportionately, because we know the African American community and people of color who have contracted COVID have had poorer outcomes as it relates to COVID. So this has affected me as a provider and engaging the community and empowering our community to, one, seek better health opportunities to improve their health, because we know that COVID affects us disproportionately because we have a lot of uncontrolled comorbid conditions. And so, what the virus does, it affects those vessels that are already injured because of our uncontrolled comorbid conditions. So, if we can, in
Wow.
turn, have those conditions under better control and improve our overall health, we will be better able to fight the virus and have less complications as a result. So I would say that, COVID has changed my delivery of services, and it actually has intensified the delivery in it as it relates to advocacy, as it relates to equity, to healthcare, because equity is a big point of having healthcare, because some people don't have access. They don't have access to healthcare. They don't have access to the treatment plans that are prescribed by providers. So it has definitely affected my delivery of care to the populations I serve.
Thank you.
Excellent. Mhm.
Back to
Dr.
you, David.
Mitchell?
Yes,
Well,
Dr. Williams,
that,
go ahead, David.
no, you got it. I was just throwing it to you.
Okay. Okay. So, Dr. Williams, as you talk about your delivery and your advocacy, how has that affected you as a professional in terms of your own personal care, and certainly with the ongoing equity issues for the African American community? It just seems like a lot to try to address. So, how have you been doing personally in terms of addressing all of that?
Um, it's been, I would say, and as I said in the prior segment, to be transparent, at times it's exhausting because of a lot of the misinformation. It seems like you're fighting the misinformation that's sometimes delivered, and also the lack of compassion for healthcare providers and healthcare workers who are putting their lives on the line on a daily basis, not just their lives, but we're putting our lives and our families' lives on the line daily. And so sometimes it gets to be exhausting, and sometimes it can be overwhelming. But I look at this whole pandemic, it is a public health issue, and it's something that we as the public have to come together to fight. We can't do it individually. We have to do it together as a unit. And so, as a medical professional, it has been exhausting, and a lot of my colleagues feel the same way. but also it's been rewarding because we've been able to save so many lives in the work that we do. And so doing this work has been very, and it's been a learning experience. I mean, we all are learning about COVID. The healthcare community, the scientific community, the public, everybody, we're all learning about this together. So it's, you know, it's one big learning experience that we're experiencing together. So, you know, to hear people say that it's not real, to hear people say that people are not really losing their lives and you're seeing people die every day in our families and our environments and communities, that can get exhausting. But we know that when we do this together and we work together, I think that we will see the light at the end of the tunnel, so to speak.
Hey, Dad. I need your help asking Jessica to prom.
Of course. Love is like the ocean. You have to tread the
Oh,
waters.
Dad. That's not the kind of help I needed. Hey, Jessica. Will you go to prom with me?
Yes.
You don't have to be perfect to be a perfect parent. Thousands of teens in foster care can't wait to share their first with you.
Can you walk us through what does normal feel like when things aren't normal?
Have we really processed the pain, the PTSD syndrome of the past year? I'm really concerned about that. I mean, I know we want to get back to normal, whatever that normal is. Are we really aware of the ramifications and how deep is it? Are we just going to go act like it's normal, we get back and forget about it? How do we process and peel this layer off of how to be healthy after what we just experienced?
You know, I think you know, and again, we want to commend everyone who's on the front line.
Yes.
You
Yes.
medical workers who've been on the front line,
Yes.
who've worked double and triple shifts and
For
having
shifts.
to
Yes.
endure the visibility of seeing
Absolutely.
people
Yes.
and having to deal with, and then having to deal with the stress from not being able to allow loved ones being close to their sick. You know, you guys, you know, our hearts really go out to you guys
Yes.
and ladies, because again, it's really, you know, without you, we wouldn't have gotten through this phase. You know, we're always winding down, we're getting close. But, you know, one thing I do want to talk about real briefly, you know, and again, we thank you so much for coming on and debunking all these myths about
Yes.
about COVID and the vaccination. It's so important that our community is educated. But I do want to know a little bit more, if you could share about KH William Enterprises and your research, because as I was looking at your bio, I was really drawn to your research and your advocacy. And tell us a little bit more about All of Us, the initiative. Just,
Oh, okay,
you know,
certainly.
yeah, I would
Yeah,
love to know
so
more about that.
okay, so the NIH All of Us research program is an initiative that was created under the Precision Medicine Initiative created under the Obama administration. And so the Precision Medicine Initiative is focused on developing more individualized treatment and care for individuals. So now we, as medical providers, we practice care based on evidence based, and only 5 to 7% of African Americans have participated in clinical trials across the country. So with that being said,
Wow.
most of the medicines and treatments that we as providers practice were tested on Caucasian men over 60. And so some of the treatments that we prescribe to our patients may not fit them specifically. we may have different reasons why we have, for instance, hypertension. Certain medications may work better for us than for other, populations. So this precision medicine initiative was created to do more individualized treatment for individual populations. And so the All of Us research program was birthed out, out of that precision medicine initiative to improve diversity in research, to increase participation in those who are traditionally underrepresented in biomedical research. And so that's what the All of Us research program is all about. The program is targeting those populations who are traditionally underrepresented, and the African American community is one of those populations. The Asian community is another, Hispanic community, LGBTQ plus, and the senior citizens. So those populations are selected by the NIH, and those are the populations who are traditionally underrepresented in biomedical research. And it is so, I wouldn't say ironic, but with COVID coming in the midst of this, research is so important for us to learn more about
Yes.
COVID-19, to learn about treatments, to learn about, improved vaccines. All of those things, play a part. And so for us, being involved in trials as it relates to the vaccine are important, because we need to know how the vaccines will affect us, because we are different. So that's what that program is about.
Well, I'm glad that I posed that question, because
Yes.
it's important to know
Yeah.
that. I mean, we are very open. Big. I'm very big on advocacy for Black men and prostate cancer. As a prostate cancer survivor, catching it very early, and where and I allowed my results to be used by Emory in their studies for African Americans, and so I'm very that when you said that, it kind of touched me in a very special kind of place, because when I was reached about sharing my diagnosis and the tissues and all that stuff that goes with it, and I said yes, because I'm very big about us doing that, and that's been a phobia. I remember my father was trying to get my father to go to the doctor. He said, "Well, if I go to the doctor, they're just going to find something." I said, "Well, that's part of the problem. That's kind of what you get. If there's something to be found, we want to find it,
Right.
So, again,
Yes.
our time is far spent. And Dr. Kimia Williams, we just want to thank you again for coming here today and
Yes.
sharing your expertise, your knowledge with us and our audience on Hope TV about COVID, the vaccinations. If there's one parting word or advice you want to give to our people before you leave, this is your opportunity.
Okay. Thank you so much for having me. It's been a great honor to be here. One parting word I would like to share is during this pandemic, focus on the positive, focus on the love of your family and friends, focus on being intentional about improving your health so that can improve your healthcare outcomes. Continue to trust trusted sources as it relates to information for COVID and COVID-19. And I strongly recommend you consult your provider regarding getting a COVID-19 vaccine.
Well, again,
Excellent.
thank you so much for being
Yes.
here. Again, the information that you share is priceless. Dr. Mitchell, I want to thank you for your work and finding such a great talent to be with us today.
Yes.
And it's thank you, Jean, for your contributions as always to the show. We couldn't do it without you. And of course, I'd like to thank our audience for tuning in every week to Forever Young. And on behalf of our executive producers, Dr. E. Dewey Smith, and the entire team of Hope TV, my name is David C. Linton, and we want to thank you for joining us. Remember, age ain't nothing but a number, and you are forever young. Until next time, take care, and God bless.
It's trial and error, and you got to do what works for you in your home, in your family, and all of those dynamics. You got to learn your children, you got to know your wife, and you got to find your way.
You can either stay and fight, or you can dip out. And dipping out, I had already experienced, so it was my job to reset.
And take the bonnets off. Take the bonnets off.